Dr. Kavanagh. He is a retired physician, also founder of a national, sort of almost international organization called Health Watch USA. And he joins us this morning. Dr. K, good morning.
Good morning, Jack.
You doing okay?
Yep, very well. I'm just kind of sheltering in place today, seeing what's happening and reading the news.
Yesterday, as you know, our governor recommended masks for all in school, vaccinated or not. Now, the key word there is recommended. Still no mandates. Do you think it's time for mandates, or you think he's just given us one last chance to do what we should really do?
Well, that's always been a hot question, whether or not you mandate. But what you want to do is to try to motivate people to wear the masks, to get vaccinated. And one of the problems we have in Kentucky is that a large percentage of the population really does not want to follow public health advice. They don't believe in it. They think it affects their liberties. And so you don't want to put them in a position where they kind of back up and say, okay, you're going to have to come down and arrest everybody in this county because none of us are going to get vaccinated. And so that's kind of the problem you have. You shouldn't mandate something that you can't enforce. You have to get the public behind you in order to convince them that this is the way we should go. Now, I do feel that private business owners, certain businesses, certain activities, mandatory vaccinations are appropriate. I feel that is the right of a business owner. And at this point in time, with this dangerous virus, vaccine passports are something that seriously needs to be considered. Because if someone has the right not to get vaccinated, I think other people who are vaccinated have the right to make sure that they're safe. Because with this virus, even if you're vaccinated, you can still become infected. You can develop mild symptoms, possibly moderate symptoms. The Israeli data shows that the vaccines are 88% effective in preventing hospitalizations, 91% in preventing severe COVID-19 and deaths. That's great, but if you're exposed to the virus all the time, it puts you at risk. And of course, as we've talked about repeatedly, and this goes way back to last year, that long COVID in patients that have asymptomatic or even mild infections is a significant problem and can cause significant disability. So yes, if you're vaccinated, you have some good protection against the severest manifestations of this disease, but you can still be injured and harmed by this virus. So those that aren't getting vaccinated are putting everybody at grave risk. I can't say that enough, Jack. It's quite upsetting. And the other thing on vaccines that people need to remember, they're not entirely designed to protect the individual, but the community. So in other words, it's a layer of armor for the individual, but the big thing is it decreases spread in the community, so you're less likely to be exposed to that virus. So there's two layers of protection that vaccine gives: a community protection, where you're not exposed to the virus as much, and an individual protection, which is a layer of armor. With this vaccine, we're almost completely lacking in Kentucky rural areas that first protection.
President Biden officially announced a vaccine mandate for all federal workers yesterday. Government employees will have to either prove they're vaccinated or submit to weekly or twice weekly COVID-19 testing, along with masking, social distancing, and travel restrictions. Mandate already getting a pushback from some of the large federal labor unions, such as the American Postal Workers Union and the Federal Law Enforcement Officers Association. About 4 million people are employed by the federal government nationwide. Should employers be allowed, in your opinion, to require that workers be vaccinated?
Definitely.
Will the White House mandate be challenged in court? What do you think?
Well, they definitely should be. I don't want a postal worker who is not vaccinated spewing out COVID on my mail be delivering my mail. I don't want to be pulled over by a policeman. Of course, I don't want to be pulled over anyways by a policeman who is not vaccinated, and you roll down your window and he's there with a cotton mask, and all of a sudden he's placing you at risk. This is common sense. Of course, people that interact with the public need to be vaccinated. People who interact with coworkers need to be vaccinated because that will decrease the risk of spread. And remember, I am saying decrease risk of spread. I'm not saying eliminate it. This Delta variant is a different type of a virus. In fact, some people are saying it shouldn't be called COVID-19 or should be given a different name because it's behaving so differently. And one of the things I want to stress to people that a flimsy cloth mask or a neck gaiter is going to do little with this virus. Some studies show 1,000 times more virons people who are infected with this are extruding, and some asymptomatic carriers who have been vaccinated are even spreading this high amount of virus. So in my book, right now, we should all be wearing masks, we should all get vaccinated, and we should try to get this surge under control. And one of the things that really bothers me is that if everybody goes out and gets vaccinated right now and says, oh, I'm vaccinated, I don't need to do any of these things, that's not the case. It takes 5 weeks to become fully vaccinated and your immunity to pick up to the point where you can ward off this virus. So we really do need to protect ourselves. We need to protect fellow man. In Florida, the hospitals are already filled to the point that they were with the last surge. So I think we really need to take some serious steps. People need to get N95 masks. You can order those online. Last night, I ordered a box from Uline. We talked about that. The letter U, line.com. They have them in stock. Amazon may also have them in stock. If they're 3M, sometimes you want to make sure they're not counterfeit. Go to the 3M website, check the lot number, etc. Make sure that they're okay. They have a whole web page set up for that. And personally, Jack, I would make recommendations across the board saying this county you can do this, that county you can do that. That's crazy. People are unvaccinated all over the place. They tend to lump together and spread the virus. And plus people travel between counties willy-nilly. So it's absolutely imperative that we do this in a uniform manner. That was one of our criticisms of last administration. Same thing's going on with this administration. And also with the numbers that are being projected, I certainly would recommend setting up contingency plans or actually even starting to set up some facilities for emergency beds that are off-site so that we have overflow beds for patients. Because I think we're going to have a lot of patients coming down with this COVID-19 Delta variant, and that is unfortunate.
We got some callers holding here. Steve, good morning. Thanks for holding.
Hey, thanks for taking my call. Hello,
Sure.
Doc. I have several questions, but I'll keep it simple and just leave it to one. How do you know that if I have the Delta variant and not one of the other variants?
Well, they would have to do sequence testing of the samples that they did the test on. But right now in Kentucky, statistically, you've got over a 90% chance of having the Delta variant. I mean, it's just taking off like wildfire. It's becoming the dominant strain. As far as treatment goes and what you need to do, it's the same because unfortunately there's not a whole lot of treatments for either one of these variants. Once you get severely sick, you're in a big amount of trouble. Still, you could try the monoclonal antibodies early on, hoping that they'll work, but the Delta variant has evaded some of those products, so they may not be as effective. The best thing, the best medicine is to avoid getting it, which means start ordering your groceries online or for pickup, start wearing N95 masks, socially distance, and be extremely careful when you're outside. This virus is much more infectious than the previous strain.
Okay, I've already had it according to the test, the nose test. I was did my quarantine and all that, and so is it true that my immunity is now 40 times stronger than the vaccine?
Absolutely not. The tests indicate that the vaccine, at least in the lab, gives you a higher immunity than getting COVID. Look at it this way. If you get COVID, you can be exposed to a small amount of virus, a high amount of virus, have a small infection, large infection, and your immunity varies. With the vaccine, you have a standardized dosage. Delta is breaking through both the vaccine and also causing reinfections. if you've been infected or had a vaccine greater than 6 months ago, you're at particularly higher risk of becoming infected. Hopefully that infection will be milder, but as we've stated, you could still get long COVID, and there's been case reports of that. So it is still a dangerous situation. Please wear a high-grade mask, an N95, and even if you have had an infection before, get vaccinated again. It will boost your immunity. It's better than boosting it by getting an infection again.
Thank you for the call, Steve. Let's Susan. Hey, Susan. Good morning.
Thank you. Several months ago, Dr. Kavanagh, we were hearing a lot on the national news about how the Delta variant was just raging through India. But lately, I'm not hearing anything. Do you know how things are there with Delta presently?
Well, presently things, according to the data, have come down a little bit, but they're still at a higher baseline than what they were pre-surge. India, it's hard to get reliable data from. The data, for example, that was reported on deaths was estimated by some sources to be only 10% what the true deaths were. They do not have a really good healthcare system and a system of reporting. I do, however, know a number of doctors in India, and the reports I got were extremely disturbing, which is one of the reasons why way back in the beginning of June on this show, we were giving out warnings regarding the Delta, because at that time it was in the United States and its incidence was increasing. And so what is happening now, I hate to say this, but it could be predicted, not because you've got some crystal ball, but because you can see what's happening in India or what happened in India. To think it's going to be any different here is really magical thinking. And unfortunately, we're going to be going through that. We've got too many people not following social distancing, not wearing masks, and not being vaccinated. So we are a setup for an extremely high surge.
Another thing, would you mind to tell me again how to order the N95 mask?
Well, as of yesterday, I went on to Uline, which is the letter U, line.com. They're a very old packing company that we've ordered packing supplies on for decades. And they do have some 3M masks, the 8200s. They're less than $20 a box of 20, so that they're relatively inexpensive. And I would try to get some of those. I do think you need a N95 or at least a KN95. Cotton masks or neck gaiters aren't going to reduce your viral load enough. That's just my opinion. But with a virus that's shedding 10 to 100 times more virons, you really need to start to block out your exposure. So I would get an N95 mask.
Susan, thank you for your call. Somebody is asking, we got a whole bunch of texts, but we're going to run out of time. Do you know about Novavax, the Novavax vaccine, and will it be available, and what's your opinion about it?
I know about it, but I haven't seen any data on it. So as for now, I'm withholding opinion. I think the mRNA vaccines have really proven to show that they are quite efficacious and safe. There is some question of how long the immunity lasts. In other words, at 6 months' time, they may start to wane. But right now, I think it's better to take the medicine or the vaccine that you have experience with, that you know that works. It has a good safety profile. So if it comes to getting a booster, I would still recommend hedging on the side of getting a mRNA vaccine.
One more real quick. We're just about out of time, but somebody is asking about the symptoms of the Delta variant as opposed to COVID-19. Are they different?
Yes, they are. And that is another big thing. They are more like a cold. You have more upper respiratory tract symptoms, sneezing, runny nose, etc. One of the reasons why it can spread more. It's also one of the reasons why the incidence may even be higher, because people think they just have a minor cold, but yet they're spreading COVID. Okay. So be careful.
Thank you, Doctor. We'll talk to you next Monday. Thank you.
Thank you.
Dr. Kevin Kavanagh.